Hi there, I'm Jana Wold and I'm the Program Director for the Adult Neurology Residency here at the University of Utah. And I'm going to be giving you a tour of our hospital and facilities today, so let's go. So here we are in one of our clinic rooms. This clinic is on the 4th floor of the Clinical Neurosciences Center, which is the building that we just walked into, and it houses neurology, neurosurgery, and neuroradiology, along with the neurosurgery OR and our neurointerventional suite, where we do all of our acute thrombectomy cases. So you'll have clinic here during your ambulatory weeks, which we are on a 4+1 schedule, so every 5th week. You'll have clinic here in the Clinical Neurosciences Center. This is our basic exam room, has everything that you should need, set up with a phone and a computer, of course. And then we have ophthalmoscopes and otoscopes in all of the rooms. Just across the hallway is where neurosurgery has their clinic. And then also we have a Neuroradiology Suite, which is super convenient because in clinic, when I'm reviewing a scan, I can just pop over to the NeuroRads reading room and get an expert opinion on my patient scans. Here we are in the Craig H. Neilsen Rehabilitation Hospital. This is a brand new facility that opened in the spring of 2020 amidst the craziness of the COVID pandemic. It's a 150,000 square foot beautiful facility that is truly state of the art, and it's the preeminent location for all the patients in the Mountain West who are recovering from neurologic illnesses. We send the majority of our stroke patients here for their rehabilitation, and we work really closely with our team and our colleagues. This is our Neuro Acute Care Unit, and this is where we spend most of our time in the hospital. So it has 34 beds, houses neurology and neurosurgery patients. 9 of these beds are set up for video EEG monitoring, and that's for our epilepsy monitoring unit. All of our nurses here are specialty trained in neurology. All of the patients have private rooms, and the vast majority of the rooms also have a beautiful view of the city and the mountains. So this is the resident call room. It's on the same floor as the Neuro Acute Care Unit, so that's where we are right now. It's pretty basic, but it has everything that you need. There's a microwave, actually 2 fridges. There's a toaster, there's a Keurig, and then a computer and a telephone over here, along with a whiteboard that has all of the important numbers, and then, of course, a bed if you have time to sleep, which I hope you do. So here we are in one of the rooms on our Neurocritical Care Unit. This is just the hallway down from the Neuro Acute Care Unit. It's a 25-bed unit that we share with neurosurgery. Again, each of the patients has private rooms, and this is staffed by one of our 5 neurointensivists. We have 2 neurology-trained neurointensivists, 1 neurosurgery-trained, and then 2 anesthesia-trained neurointensivists. Residents really enjoy their time over here. We always have a resident on the NCC unit. This is the opportunity to take care of critically ill patients, but also to do a lot of procedures if you choose to. We have 24/7 coverage by a neurointensivist, so even when you're on night float, there's always an NCC attending in-house. are in the Neuroradiology Suite, which is on the first floor of the hospital. We spend a lot of time down here consulting with our neuroradiology colleagues. This is one of the premier fellowships for neuroradiology in the country. When you're on the inpatient service, we often come down here to go over films with our clinicians here, and we work very closely with them. This is where Dr. Ann Osborne still practices, and she wrote the first neuroradiology textbook. It's also where StatDX started, which is an online diagnostic tool. So here we are in the trauma bay, in the emergency room. We actually have 4 trauma bays here for our level 1 trauma center. We get a high volume of brain attacks, which is what we call our acute stroke program. We actually don't take our stroke patients to the trauma bay. We take them immediately to the CT scanner because that has greatly reduced our door-to-needle times. But after we get a CT, we come back to one of these bays, and then we assess our patient and get an NIH stroke scale. We work very closely with our emergency medicine colleagues. They have a fantastic residency and also fantastic attendings, and we have a very collaborative relationship with them. Residents get call money that can be used here at the cafeteria behind me. It also can be used at Starbucks, also can be used over at our children's hospital where they have a separate cafe. And every weekday, a different restaurant is featured here in our cafeteria. So local cuisine, like Mexican food, there's a day that's Indian food, Greek food, etc., which allows a little bit more variability in the lunch menu. Here we are in the hallway that connects the main hospital to both Primary Children's Medical Center, which is our pediatric hospital, and also to the Moran Eye Center, which is the ophthalmology center. You will spend time on the neuro-ophthalmology service over in the clinic, and then you also will spend 3 months at Primary Children's Hospital, which is the premier pediatric hospital in the Intermountain West. Our residents love working with our pediatric neurologist and get to see lots of unique cases during their time there. So we're back in my office now. I hope that you enjoyed the tour. I wish that I could have you all here in person to really get to see our beautiful hospital and also the surrounding region. But please check out our website, look at the other videos that we have available, and overall, just please come and interview with us.